Okay, let's dive into this. Welcome to today's Explainer, where we're going on a truly fascinating journey. We are going to trace the exact path of a veterinary x-ray, starting all the way down at pure fundamental physics and following it right through to the moment it becomes a life-saving clinical diagnosis. So if you've ever found yourself wondering how these invisible waves capture the hidden mysteries inside an animal's body, well, you are definitely in the right place. Let's get started. Here's how we're going to structure our exploration today. We've got 6 key stops: capturing the perfect radiograph, handling and viewing films, the art of interpretation, diagnosing animal diseases, the magic of contrast, and we'll wrap up with advanced techniques and safety. All right, section 1, capturing the perfect radiography, the big 3. So the first of our big 3 is detail. Detail is basically the degree of definition, how true and crisp the reproduction of that object is on your film. But here's the thing, detail is incredibly fragile. Literally any movement from the patient, a tiny shift of the cassette, or even a slight bump to the X-ray machine itself is going to cause motion blur and cause a sudden loss of that critical definition. You've also got to consider the distance to the focal spot and make sure your exposure is dialed in perfectly to avoid fogging. The second factor we need to look at is density. Now, what's really interesting about this slide is understanding that in radiography, density actually refers to the degree of film blackness. It's not about thickness, it's about how much light is absorbed by the exposed film. And the golden rule to remember here? Density varies directly with milliamperage. If you crank up the milliamperage, you produce more X-rays, and boom, you get a darker image. Drop it, and you get a lighter one. It's that direct. The final piece of this triad is contrast. Contrast is simply the difference you see between the blacks, grays, and whites on the film. But unlike density, contrast varies inversely with kill voltage, or KVP. If you use a lower KVP, you're going to produce what we call a short scale of contrast. But honestly, you have to be so careful here. Even if you nail the settings, something like secondary scattered radiation, or even something as simple as using a developer that's too warm in the darkroom, can completely ruin your contrast. And this brilliantly illustrates exactly why those different shades of gray appear the way they do. It's all about shadows and atomic weight. It's almost like a giant shadow puppet show. As X-rays pass through an animal, different tissues absorb different amounts of radiation simply based on their atomic weight. High atomic weight materials like barium at 56 or bone at 14, they absorb a ton of X-rays. Because those X-rays are blocked, the film underneath isn't exposed, which leaves a bright white shadow. On the flip side, gas has a tiny atomic weight of just 1 to 2. It lets the X-rays blast right through, hitting the film and turning it totally black. Moving right along to section 2, handling and viewing films, from darkroom to lightbox. Now, we transition from physics to actual physical practice. Step into the darkroom with me. This space requires strict, unyielding protocol because exposed films are just incredibly sensitive. You must only handle the film by holding its absolute corners. When you're dealing with cassettes, the loaded and exposed ones have to be kept with their radiopaque surfaces facing upwards, no exceptions. And to protect against any stray radiation ruining your hard work, all unexposed films must be rigorously stored away inside lead-lined boxes. Once that film is developed, we step out and head to the light box. I want you to imagine you're wearing the white coat right now, walking into a semi-darkened clinic room. There are absolute, non-negotiable rules for placing films on that light box. For a dorsiventral or ventrodorsal chest view, the left side of the film must face your right side. And for lateral views, the anterior aspect is always directed towards your left. Sticking to these conventions is crucial. It prevents disastrous misinterpretations. Okay, section 3, the art of interpretation, reading the shadows. So what does this all mean? How do we interpret these shadows accurately and actually turn them into a medical diagnosis? Well, it's not just staring at the film and guessing. A proper interpretation rests on 3 foundational pillars. You absolutely must have a comprehensive case history. You need a thorough physical examination of the animal. And, of course, a perfectly executed radiographic technique. If you're missing even one of those 3, the shadows remain exactly that, just shadows. Let's look at some specifics in section 4, diagnosing animal diseases, disease signs. These signs are like clues in a medical mystery. Take a condition like a pneumothorax, for example. Air enters the pleural cavity, and that causes the lungs to collapse. When you look at the radiograph, the lack of surrounding lung tissue creates this incredibly vivid, unmistakable image of what literally appears to be a floating heart shadow inside the chest. It's a striking visual. Or consider an intussusception, which is where the intestine kind of telescopes in on itself. On a plain standard film, it might just look like a dense sausage-shaped mass. Kind of vague, right? But if you administer a barium enema, it outlines the layers of the intestine and creates this highly specific, highly memorable visual cue that we call a coiled watch spring pattern. It brings that dense medical terminology right to life. Then, of course, we have massive emergencies like gastric torsion. This is where the stomach twists and bloats incredibly fast. On the film, it completely overtakes the anterior abdomen. It presents as this huge, greatly distended, gas-filled shadow that actually shows clear compartmentalization of the stomach. It's a very dramatic, very urgent radiographic sign.
Section 5. The magic of contrast, enhancing the unseen.
Here's the challenge. Sometimes organs naturally blend right into the surrounding soft tissues, and we have to artificially manipulate the shadows to see them. So the crucial point is understanding the tools we use to do this. We can use positive contrast, bringing in high atomic weight materials like barium or iodine, which block X-rays and paint those hidden organs a bright, stark white. Or conversely, we can use negative contrast. This means introducing low atomic weight gases like CO2 or just room air, which let the X-rays blast right through to paint the hollow spaces black. Now, when we use water-soluble positive contrast agents, which are typically iodine-based, we basically have two main categories. You've got the older conventional ionic media, like Conray or urographin. These are hypertonic, meaning they carry a higher osmolarity. But the newer low-osmolar non-ionic media, like Omnipac or Niopam, are just a massive step forward. They offer fantastic visualization, but with significantly lower osmolarity. Ultimately, that means less toxicity and a whole lot less irritation for the animal. A real game changer.
And finally, Section 6. Advanced techniques and safety pushing the boundaries.
Let's look at some highly specialized procedures. Take intravenous urography, or IVP, which is used to assess kidney function and visualize the renal pelvis. The protocol here is extremely strict. First, you withhold food from the animal for 24 hours. Then, you inject the contrast dye as a single IV bolus. Next, you apply a compression bandage to the abdomen. This keeps the dye concentrated right there in the urinary tract. And finally, you meticulously take sequential films at 1, 5, 10, and 20-minute intervals, so you can literally watch the kidneys process the contrast. Let's move to and see how this builds into even more complex diagnostic territory. We can literally map out the entire vascular system, even the cerebral vessels in the brain, using angiography. We can outline the spinal cord subarachnoid space to pinpoint disc lesions through myelography, or we can perform cystography, injecting both iodine and air directly into the bladder to reveal radiolucent stones. The diagnostic power we have here is just staggering. But as we wrap up this explainer, we really must ground ourselves with a very sobering reality. While these incredible shadows save animal lives every single day, the ionizing radiation used to create them demands profound respect. Blood-forming organs, lymphoid tissue, embryos, they are all highly, highly radiosensitive. As our source text starkly warns, X-rays have a long-term effect of producing cancer long after any immediate irradiation injury has healed, which leaves us with a vital question for every veterinary professional out there. How do we continuously balance the incredible, immediate power to diagnose against the invisible, lasting risks of the very tool we wield? Definitely something to keep in mind the next time you're looking at a radiograph. Thanks for joining me on this explainer, and keep learning.